Hello. The topic to be discussed will be anxiety. Here are some information about it. Anxiety is a feeling of worry, nervousness, or fear of an event or situation. It is a normal reaction to stress. It helps you stay alert to changing situations at work, studying more for a test or focused or an important speech. Generally, it helps you cope with problems. However, anxiety can incapacitate you if it interferes with your daily life, such as making you fearful of non-saying everything activities like riding the bus or talking a colleague. Anxiety can also present itself as a sudden terror attack when there is not threat. Generalized anxiety disorder. People with this disorder worry about common problems like health, money, work, and family, but their worries are excessive and they have them almost every day for at least 6 months. Panic disorder. People with panic disorder suffer from panic attacks. These sudden and repeated moments of intense fear with no apparent danger. Attacks come quickly and can last several minutes or more. Phobias. People with phobias have an intense fear or something that poses little or not real danger. Your fear might be of spiders, flying, going to crowded places, or being in social situations.
Symptoms of generalized anxiety disorder. People with generalized anxiety disorder display excessive anxiety or worry, most days for at least 6 months, about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. The fear and anxiety can cause significant problems in areas of their life, such as social interaction, school, and work. Generalized anxiety disorder symptoms include feeling restless, wound up, or on edge, being easily fatigued, having difficult concentrating, being going blank, and being irritable, having muscle tension, and difficulty controlling feeling of worry, and having sleep problems such as difficult falling or staying asleep, restlessness, or unsatisfying sleep. It is not entirely clear what causes anxiety disorders. Certain life experiences, such as a traumatic event, seem to cause anxiety disorders. The medical cause for some people, anxiety be related to a high health problem. In some cases, the signs and symptoms of anxiety are the first indicators of an illness. If your doctor suspects that your anxiety may have a medical cause, he or she may order tests that look for signs of the problem. Some examples of medical problems that might be related to anxiety include the following: heart disease, diabetes, thyroid problems such as hyperthyroidism, breathing disorders such as chronic obstructive pulmonary disease, inappropriate substance use or withdrawal from alcohol, anti-anxiety medications, chronic pain or irritable bowel syndrome, rare tumors that produce fight or flight reaction hormonals. Sometimes anxiety can be a side effect of some medication. It is possible that your anxiety is caused by a high disease in the following causes. If you do not have blood relatives such as parents or siblings who have anxiety disorders, if you did not have anxiety disorder as a child, if you don't avoid certain things or situations because of anxiety, if anxiety occurs suddenly unrelated to life events, or if you have no history of anxiety. Risk factors. Researchers are finding that both genetic and environmental factors contribute to the risk of developing an anxiety disorder. Although the risk factors for each type of anxiety disorder can vary, some general risk factors for all types of anxiety disorders include temperamental traits of shyness or behavioral inhibition in childhood, exposure to stressful and negative life or environmental events in early childhood or adulthood. A history of anxiety or other mental illness in biological relatives, some physical health conditions such as thyroid problems or heart arrhythmias or caffeine or other substance medication can produce or aggravate anxiety symptoms. Physical health examination is helpful in the evaluation of a possible anxiety disorder.
It is estimated that in Mexico at least 40.3% of citizens suffer for generalized anxiety disorders, the most common mental health disease in the country. Data on the prevalence of anxiety disorder in Mexico indicate that conditions are the most common mental disorders in the Mexico population. About 40 to 15% of the individuals young and anxiety disorders, and this prevalence reaches up to 80% in the child and adolescent population. Fernandez Salazar projection that 7.5 of 10 people unreally suffer from anxiety. The most unreal thing about this situation is that Caroline really suffer from it. The prevalence rate is 4% in men compared to 7% in the woman. Complication. Anxiety disorder doesn't just mean big worry. It can also cause or worsen other mental and physical disorder, such as the following: depression, which often occurs in conjunction with an anxiety disorder or the mental health disorders. Substance abuse, sleep problems, insomnia, digestive or intestinal problems, headache and chronic pain, social and isolation, problems at school or work, and suicide.
The main treatments for anxiety disorders are psychotherapy, medications, or both. Cognitive behavioral therapy is a type of psychotherapy that is often used to treat anxiety disorders. Each different way of thinking and behaving, it can help you change how you react to things that cause your fear and anxiety. Must include expert therapy, which focuses on confronting your fears so that you can do the things you have been avoiding. Medication to treat anxiety disorders include anti-anxiety medications and certain antidepressants. Some types of medications may work better for specific types of anxiety disorders. You need to communicate well with your healthcare professional to identify which drug is best for you. You may need to try more than one drug before you find the right one.